continue having actually, pockets of cholera in many other counties. Now, we are more focused on actually infectious disease outbreaks, but we also know that we've been having issues to do with flooding, we've been having issues to do with maybe fire raising some, parts of the countries. And why are we doing this? I think we have been seeing that different counties have different ways of responding to these outbreaks, but also we have seen delays in coordinated response.
So the first part of our presentation, we were given a table to fill in with details of the event that took place. So the scenario name, we called it Public Health Emergency of initially unknown etiology in Busia County. And the facility is Port Victoria Sub-County Hospital. The date and time of the first signal, we didn't have an exact date in the scenario, so we just said it was early June. Then our initial assessment for this, we used, there's a tool we were given, which helps us decide what kind of event. We said it is serious.
Stock owners report mass abortions in cattle, goats, and sheep. Veterinary officers detect hemorrhagic signs in animals, and samples submitted at Garissa Regional Veterinary Labs test positive for RVF. 3 days, within 3 days, 10 herders present with fever, jaundice, and bleeding. 3 tests positive for RVF.
So this was our scenario, that on 3rd October 2025, a tanker transporting benzene in Turin from Nairobi industrial area to Mombasa overturned near the river, releasing toxic chemicals into a drainage channel flowing into the Nairobi River. And then residents downstream began reporting a strong chemical odor and experiencing nausea, dizziness, and cough, with dozens seeking care at the Athi River Sub-County Hospital.
On 5th October 2025, the Migori County Department of Health received reports of an unusual cluster of acute watery diarrhea and dehydration from a riverside village in Suna West Sub-County near the Kenya-Tanzania border. Within 2 days, 25 suspected cases and 3 deaths were recorded.
I think that's where everyone is moving ultimately. So the paper-based one is good at this level, but the team should also consider if we can kind of digitize some of these items, because then it helps to pull all the information from various sources in a very simple way, so that if I'm sitting in my office at the sub-county and I've lost some of these documents, because physical documents tend to get lost or misplaced, then I don't have to worry about picking 5 or 4 different tools to read at a time. And I think we already have like the other tool, which is for outbreak response.
So things that delay outbreak management and issues to do with decisions on when to notify the next level. Sometimes also the other way around happens, where the next levels are overwhelmed when it's actually sometimes unnecessary. You find even very simple things that can easily be managed at the county level.
Came in acknowledging that we already have quite a number of documents, a number of things in the health security space, be it IDSR 3, be it 717, collaborative surveillance. There are so many documents. But the $1 million question is this: if, let's say, we had a case of whatever condition, let's use Ebola for the sake of, because it's one that scares everyone.